Tuloy pa ba yung trend na there was a time na nursing was so popular, you know, like hot pandesal, even our doctors were leaving for abroad to work as nurses, especially in the US.
Ano lang yan eh.
Tuloy pa rin ba yun? Wala na.
Not so much. Demand and supply kasi. So there was less demand for nurses. That's why.
Saka mas malaki nga kasi yung sahod, which
Yes.
which brings us back to the question of providing incentives to people to take up medicine. Dahil kulang nga tayo ng doktor.
Actually,
That's another
Yes.
question for you. How do you encourage the youth to study for how many years? 4 years pre-med,
yes.
and then medicine 4
Actually,
years, and
10
then
years. But I studied 18 years. So 3 additional years internal medicine, 3 years cardiology and public health.
Mag-specialization ka pa.
Kailangan.
And
So
it's very expensive.
around 16 years siya.
Kaya nga, how do we
Kailangan
entice
subsidize. It
youths?
depends if the government has money, di ba? But my first focus is to treat the poor. Libreng gamutan, libreng operasyon, and of course the manpower is very important.
Okay.
Oo.
Very
Depende
simple.
sa item, depende sa DBM, diba? The problem is there's no item.
Okay. But Doc, very simply, ano yung basis for that? Libreng gamutan, libreng ospital, and so on. Parang, syempre, who wouldn't want that? But what's the simple mechanism that makes you believe that that's actually feasible right now?
Pag sinabi ko libreng gamutan, we just increase the number of free medicines for the poor, not for the whole country. I don't think it's doable. For libreng operasyon, I focus on simple operations that are doable and cheap. Like, ano yung mga simple operations for goiter, for myoma, for breast mass, for hernia, gallbladder. Patients can get operated for 10 to 15,000 pesos only. You can save one life.
Okay.
So there are around 50 to 100,000 of these patients who are, they cannot be employed, they're just at home, they cannot work because they're bleeding. So if we save these patients, doable very cheaply.
Yes, but pagka sinabi nating libre, we also don't, I mean, libre as far as the patient and the person is concerned, but we also don't mean that literally. I mean, ultimately, somebody pays.
PhilHealth pays.
PhilHealth pays.
PhilHealth pays.
And PhilHealth can cover this right now?
The problem kasi is PhilHealth is covering so many different diseases and some of them are very expensive. Like kidney transplant, 600,000, heart operation, 500,000. I mean, those are good, those are okay. But if you look at the numbers, these simple operations, which are equally life-saving, you can, for 600,000 patients, you can operate on how many? 30.
But on
by
on the funding side of this, the program that you're suggesting
we
will not
need to get
redound
more
to us.
funding.
So more contributions on the part of PhilHealth members?
I think we have to increase it a little.
By how much?
If we want to get more from PhilHealth, we need to put in a little more, maybe 100. I think they are increasing it already to 300 pesos. And some of them are being paid by LGUs, and the national government also gives an amount. Because if we're only paying 200 pesos, 2,400 a year, how can you expect to get free everything?
Or you can increase the excise tax on
Yes,
sin taxes,
on sin
which
taxes.
I'm sure you're
For
supporting.
tobacco, I'm supporting the 70 peso increase. Because for us doctors, it's not a question of revenue. We're looking at it as a health issue. If you increase the price of cigarettes, the number of poor people smoking will be reduced. So you reduce the number of lung cancer, heart patients, stroke patients. You will save, they say, 200 billion in a year.